My name is Luke Plaisir. I'm an SPT at Rocky Mountain University of Health Professions, and for this I'll be working under the direction of Dr. Colby Clausen. And today we're going to be working with a 26-year-old patient. Her name is Bonnie. Bonnie is coming into the clinic complaining of low back pain in the right side, just in the L5 region. That started about 2 years ago during her last pregnancy. So we've determined that she will be receiving some ultrasound treatment today, and the reason for that is because she is in the chronic, non-inflammatory stage of healing. The tissues just can't seem to be able to heal, and so we're going to try to use some ultrasound to help with that. So because she seems to have some muscle strains and also some associated pain as she is bending forward, we're going to be using the ultrasound. Those are some of the indications for using ultrasound. Some contraindications that we need to be aware of with Bonnie is whether or not she's pregnant, so I'll be asking her that as part of the treatment. And then as well, because it is on the back and next to the spinal cord, we also need to be aware of not putting the ultrasound over the spinal cord itself, so we'll be aware of that. Otherwise, we'll just get in and start treating Bonnie. So, Bonnie, how you doing today?
Good.
Good? Okay, appreciate you coming in, and we've been talking about your low back issues and kind of how that's came about with your last pregnancy and that sort of thing. So what I want to do for treatment today is what we call therapeutic ultrasound. Have you ever heard of that or received any of that before, Bonnie?
I've heard of it before, but I've never received treatment or anything.
So you're probably familiar with ultrasounds. You know, with your pregnancies, you probably had the imaging side of ultrasound.
Yes.
So what we're going to do today is it's similar but different in that we're going to be using sound waves to apply heat to your tissue in your back to try to help those tissues to be stimulated to repair and remodel the way that they should. Right now you're in what we call a chronic non-inflammatory stage of healing, where your tissues just can't really figure out what they're supposed to do to heal, and that those tissues and your muscles are kind of strained. So we're going to try to just heat them up and give them some stimulation to start repairing the way that they should normally. So just to explain kind of how that happens, I'm just going to show you here. So we have this little applicator here that's attached to this machine. And what I'm going to be doing is taking this gel and applying it onto the head, and then if you're okay, I'll need to have access to your low back where you've been having pain, and then I'll just apply this and those sound waves to your back. And the gel is just a medium that we just need to send the waves through, and so it can function correctly. So but other than that, if you're okay with that, if that sounds like that's okay, and I can expose your low back and have access to the skin there, then we'll go ahead and we'll start with the treatment. Does that sound okay?
Yeah, that's great.
Okay. And with this, Bonnie, since you've never had it, I'll just tell you that the gel will be cold, which I apologize for in advance, but we will be trying to warm the tissues, so you should feel some warmth, but it shouldn't get hot to the point that it's painful, and you shouldn't feel any sort of discomfort in the form of like shocking electrical, that sort of thing. Okay, so if you ever do feel uncomfortable or anything with it, then just let me know and we can stop the treatment and make sure that you're taken care of that way.
Okay.
Before we start with the ultrasound, are you, that you know of, pregnant?
No.
Okay, great. Awesome, perfect. Okay, so what I'll do is I'll just get this ready to go here. First thing that I want to do is set up the settings for the machine. So we're going to go to our ultrasound setting here. We're going to be doing it for a 10-minute interval, and because it is a deep tissue that we're trying to affect in the back, we will have our frequency at 1 megahertz, and we are going to be using the thermal setting for ultrasound, which is 100% duty cycle or continuous on this machine. We also want our power or intensity to be up to, I'm going to use 1.5 because it is a small area, so we don't want to overload the tissues with too much energy at one time. So we're going to go with 1.5 watts per centimeter squared there. And then as far as the application, the size of the applicator here, we're only going to be doing 2 to 3 times the size of this applicator head. So we don't go crazy with it that way. So like I said, 10 minutes for the time, and so I'm going to get this gel ready to go here. I want to make sure that when we use the machine as well, that we have enough gel so that we cover the whole head. And when we use the machine, we don't turn it on until the head is actually on the patient's skin and with the gel on it, and then turn it off before we pull it off as well. So, Bonnie, I will just have you lay down here on the table. We'll go face down. And great. And are you okay?
Yeah.
If I expose this low back here? And what I'm going to do is I just have some towels here. I'm just going to help with draping, what we call draping, just to make sure that we have everything covered that needs to be covered, if that's okay. Okay, awesome. So I'm just going to drape this here on your low back. Okay. Awesome. Okay. Great. And then I've got another towel here. We'll just drape up and over. So we're well covered, well taken care of there. And Bonnie, the way you described the pain for me, you said it's kind of in the low back area here. Okay, so I'm just going to find a structure, reach your PSIS, and then we should just be right in that area, just superior to it there. So I'm going to go ahead and come over and get my head full of my gel, and I apologize again because it is going to be a little chilly, but we'll just get that on there, and then before we start it, make sure that's all nice and flat on the skin, and then I'm going to come back and actually start the machine. Okay, awesome. And like I said, Bonnie, if at any point it feels uncomfortable, you just let me know.
Okay.
But it should feel warm. And at this point, Bonnie, what questions do you have for me about this?
I don't think I have any.
Nothing?
Yeah.
Okay, how's that feel so far?
Good.
Feeling okay?
Yeah.
Okay.
Still a little cold, but
Yeah, that'll heat up relatively soon here.
yeah, no, it's definitely good.
Okay. And we'll come back, and for the sake of time, we'll just we'll stop the machine. Okay, and then we can remove the head. And great, and I'm just gonna take a towel here and just wipe this head off. And Bonnie, how did that feel? Was there any pain, discomfort, anything there?
Nope.
Okay, felt all right. Okay, so what I do want to do is I just want to inspect the skin really quickly, just to make sure it looked good before we applied the gel. I just want to make sure that it still looks good, so just try to gently wipe this off here. So you're not all goobery when you go home. You got enough on your plate with kids running around the house. Okay, great. Yeah, so your skin, just on a quick little visual here, still looks good. It doesn't look like there's any irritation to it, other than, I'm sure, those uncomfort from your strain, but great. Okay, so we're good there, Bonnie. So any questions for me?
Nope.
Awesome, great.